Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a unique show for you this evening. We're talking about the collaboration between Penn Foundation and St. Luke's University Health Network. Tonight we'll be joined by a talented panel of medical experts from the field. Stay tuned, this is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at mental health services at St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Amy Maurizio. Amy is the Director of Operations for Substance Use Disorders and Recovery. In this role, she's responsible for ensuring that the network's SUD programs are providing evidence-based, recovery-focused, quality care and meeting the needs of the community. Amy earned her master's degree in public health education from Arcadia University and her master's of business administration from Strayer University. Thanks for being here, Amy. Tell us a little bit about your background and how did you become interested in a career in the mental health field?
When I was in college, undergrad, I originally started out actually in the medical field, but quickly changed gears. And I wasn't sure what I wanted to do. And I got involved in some psychology courses, and it became a huge interest for me. And I quickly got a job just after college, and I've been in the field ever since.
Joining our panel next is Amy Allinson Dundon. Amy is the Network Director, Clinical Therapy Services for Behavioral Health Services. Mrs. Allinson Dundon's specialties include, but are not limited to, the treatment of addiction and substance use disorders, trauma, critical incident stress, and mood disorders. Leading the clinical psychotherapy team at St. Luke's, Amy assesses and supervises complex psychological cases, provides consultation for network physicians when needed, and ensures quality care for all outpatient, partial hospital, school-based, and integrated care involved clients. Amy earned her Master's of Science degree in Counseling and Human Relations from Villanova University in 1995, where she concentrated in addiction therapy. Thanks for being here, Amy. St. Luke's and Penn Foundation came together almost a year ago, and the partnership has really enhanced existing services, and it's also created new services that didn't exist before. Tell me a little bit about this merger and your role in it.
We are so excited to have merged, Ashley, with Penn Foundation and the wonderful folks that they have down there in programs. I am Network Director for Clinical Therapy Services, and what that means is that I oversee all things clinical for ambulatory psychiatry. So in my role with Penn Foundation, I get to work with their outpatient teams, help with programming, clinical programming, and we got a lot of assistance from our drug and alcohol SUD experts down at Penn Foundation. So it's been a really great collaboration.
We're excited to learn more about it, so thanks, Amy. Let's meet our final panelist, Maureen Gingrich. Maureen is the Vice President of Integrated Care for St. Luke's Penn Foundation. In this role, she's responsible for integrating behavioral health into primary and secondary care settings, as well as overseeing the health connections and administrative case management programs. Maureen earned her master's degree in clinical social work from the University of Pennsylvania and her master's degree in public health from Drexel University. Maureen, welcome. So good to have you here.
Thank you. It's great to be here.
The need for mental health and substance abuse services has really grown in our community. Why is it so important that these services are available to people who need them?
All of us can experience times of stress or increased anxiety, and I think that it's really created an opportunity to open up the conversation further about behavioral health. And it's so important for everyone in the community to have access to those services and that treatment close to home. So we want those services to be easy to access, close to people's home communities, and connected with the supports and the services that they feel are important to their care.
Thank you all for giving us some background information on your expertise and interest in mental health services. Next, we'll dig deeper into the care offered by St. Luke's Penn Foundation. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
My addiction impacted my life in every way possible. My name is Althea Sussman. I am 37 years old, and I have been clean and sober for 6.5 months. I basically became very isolated the past few years. I had no grasp of reality whatsoever. I had stayed at someone's house, and when they dropped me back off, she was like, "Where do you want to go?" And I said, "Just drop me off at the train station." Little did she know I was living there. I was devastated. And so I called Penn Foundation because I had this idea in my head, if I could get into Penn Foundation, I might have a chance. Having St. Luke's and Penn Foundation as a resource in the community is wonderful. Penn Foundation is different than the other rehabs because it's a doable schedule. It's smaller. They listen to you when you have symptoms and need medication. The people that work there are like the greatest people ever. And I really, really mean that. They never made me feel ashamed. They never made me feel bad. Every time I was there, they would tell me there's hope. Recovery is not just like something you do and then go back to the way you were. It's a different life. It's a new life. It's a whole new path. But my outlook on life is a lot better. I used to only see a lot of like the darkness in life. And there is a lot of sadness in the world. But now I feel like what I can do is just be the best me that I can be. And that makes me able to sleep at night. If anybody is struggling with mental health or addiction, there is hope. There is so much hope, and getting help is the greatest thing I ever did for myself. So I encourage anybody else to do that.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching our program tonight and for providing us with questions for our panel, which we'll get to later in the show. Joining me is a talented panel of medical professionals, Amy Maurizio, Amy Allinson-Dundon, and Maureen Gingrich. We've learned about your expertise and how St. Luke's and Penn Foundation came together. Now let's talk about some of the services offered by St. Luke's Penn Foundation. Amy Maurizio, I'm going to start with you. Can you tell us about the various levels of care at St. Luke's Penn Foundation, and do you offer inpatient and outpatient services?
So we offer a wide variety of services for the substance use disorder community, starting with a hospital level detox, which is currently located at Sacred Heart Hospital. And that's for individuals who have underlying physical health needs that can be complicated during detox. We have subacute rehab services and also subacute detox services at the Sellersville location. And those services are for individuals who need a residential level of care, but not quite to the level of inpatient hospital. We have 24-hour nursing care, clinical services offered by licensed counselors. And then we also have intensive outpatient services, which is an outpatient level of care. Currently, we offer that at 3 locations at 807 Lawn Avenue, 711 Lawn Avenue, and a Colmar office as well. And that is 9 hours of service per week at a minimum that combines group and individual therapy, as well as psychiatry and medication-assisted treatment.
So I think that's important for our viewers to know. Depending on the level of care that's needed, St. Luke's Penn Foundation will be able to accommodate that. Amy, I'd like to ask you, the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychology declared, quote, a national emergency in child and adolescent mental health in October of 2021. What services are available for children and adolescents, and when does a doctor or a family know when it's more than just seeing your pediatrician?
We have seen an increase all over the nation, Ashley, for child and adolescent need. And some of it is related to pandemic. Some of it is probably natural need. Here at St. Luke's, we have individual outpatient psychotherapy. We have therapists trained in play therapy. We have therapists trained in therapy with people on the autism spectrum. We also work really closely with developmental pediatrics at St. Luke's for kids with special needs. We recently at St. Luke's opened an adolescent inpatient psychiatric floor at St. Luke's Easton. So we've got the capacity for adolescent inpatient psychiatry. We are opening our first adolescent partial hospital program in Allentown on Chew Street. So, and that will be, the partial will be for children ages 14 to 17. I think that the key to the question you asked about, well, how do you know when it needs to go beyond your family doc or your pediatrician, really is when a child's mental health needs are impeding kind of their ability to function on a daily level. We know that some anxiety is normal, some depression is normal, social anxiety is normal, especially coming out of COVID and coming off of virtual and going back into the classroom, and issues with peers. Parents, you know your kiddos best. So when you're seeing signs in your kids that kind of start to make you question what might be going on, your pediatrician will often be able to help guide you in terms of, we need to look at something medical before we look at something psychological and rule things out. You know, when your kiddo's asking for help, certainly don't ignore that.
Which really is great advice, Amy, and to listen to your kids and seek extra help, and to know that St. Luke's and St. Luke's Penn Foundation have expanded and continue to expand these services so much. You know that there's probably some sort of solution out there. And Maureen, I want to turn to you now, because as the Vice President of Integrated Health Services, you know that it takes funding to do all of this. And I know St. Luke's Penn Foundation received a federal grant. Can you tell us a little bit about how that increases access to care, and it kind of creates bridges in maybe the gaps that sometimes exist in our health system?
When we began our integration with the St. Luke's Network last fall, we were really excited to be awarded a grant for $3.9 million over 2 years from the Substance Abuse and Mental Health Services Administration, or SAMHSA. And this is really a capacity building grant to help us move forward our integration into the St. Luke's network, to improve our care coordination, and to improve access to a wide variety of services. It really funds the implementation of something called the Certified Community Behavioral Health Clinic model, which is a model of care that really focuses on holistic behavioral health care that's available to everyone in the community, regardless of who you are or your ability to pay. And this funding will help us continue to increase our services, our access to our services, and focus on reaching populations in our community who may be interested in care. One of the areas that we're focusing on is the veterans in our community, as well as individuals who are living with serious mental illness.
And you mentioned people who might be in crisis, Maureen. Amy Maurizio, let me ask you, St. Luke's has 14 campuses over a huge region. What can someone expect if they come to an ER with an addiction issue? How are they connected to care? They come in, they know they need help, they don't know where to go. How does that work?
Currently, we offer warm handoff services in most of the EDs in the network. And what the warm handoff program does is it provides typically a certified recovery specialist or a case manager who can meet with that individual, share lived experience, and help to connect them to treatment or other resources. Individuals can also be connected directly to detox from any ED in the network. So for individuals that are ready for that level of care and meet the criteria for that level of care, they can be connected quickly to those services. Even if someone is not necessarily ready for treatment, the warm handoff can provide housing resources, food resources, childcare resources, which sometimes is really what people are looking for. And they know it's a place that they can walk into and they're not going to be turned away.
What great information from all of our panelists, but we're not done yet. After the break, we'll learn more about the treatments, recovery options, and new programs offered at St. Luke's Penn Foundation. You're watching St. Luke's Health Now. Stay tuned.
One in 4 people struggle with addiction, and for those that do, there is hope, even when it feels hopeless. With a holistic approach to care, Penn Foundation assesses each individual's treatment needs and is sensitive to past situations of trauma. Penn Foundation offers an intimate inpatient center and a team of counselors, nurses, and psychiatrists who can help you find a life in balance through an individualized plan for recovery. You are not alone on this journey. Let us walk with you.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have an interesting show for you tonight. We're talking about St. Luke's Penn Foundation. In case you're just tuning in, I'm joined by three St. Luke's medical professionals, Amy Maurizio, Amy Allenson-Dundon, and Maureen Gingrich. Thank you all for being here. In the first part of the program, we talked about your backgrounds and why mental health services are so important. Now let's dive deeper into specific treatments and the new programs that are offered by the St. Luke's Penn Foundation. So Maureen, in the St. Luke's Penn Foundation campus, you have a primary care practice, which is really interesting. Tell me how that not only benefits the community, but the patients. How do those two work together?
We are so excited to have a St. Luke's primary care practice here on our campus. This is just really a huge advantage for us in terms of being part of the St. Luke's network and a great opportunity for the community to receive their physical health and their behavioral health all in one location. I think it's really important that people in the community understand that we want to focus on all aspects of health, that it's important that this care is coordinated and collaborative across all parts of the system and with their goals at the center of their care. So bringing primary care and behavioral health together really helps achieve that. And it really aligns again with the purposes of the grant that we received in terms of making sure that we're taking care of the whole person.
I absolutely love that level of communication because often people have a relationship with their primary care physician or their pediatrician, as we mentioned earlier in the program, Amy, and that person is the person who they trust to get them to that next level of care. Speaking of that next level, Amy Maurizio, I want to talk to you about overdosing and the death rate that has gone up with that, especially during COVID, people's fear and inability to get connected to services. Tell us a little bit about the protocols that are in place and how St. Luke's Penn Foundation is overcoming those challenges and kind of catching up with what maybe was left behind a little bit for the last couple of years.
Early in the pandemic, we decreased our census to better promote social distancing, having smaller group sizes, which was important to prevent the spread of COVID within the residential unit. We're still operating at that lower capacity as of right now. We hope to go back to our full capacity soon, but we test everyone upon admission to the program. If an individual tests positive, we do not admit them. We access other resources. We also monitor temperatures on a regular basis for our individuals. And again, we require masking, social distancing, and the small group sizes. And then in our outpatient services, it's similar. We were offering hybrid services, both virtual and in person. Again, requiring masking, asking individuals not to come or participate virtually if they're experiencing any sort of COVID symptoms. We tried to make it so that that fear is not a barrier for people. And I think that our patients appreciated that throughout the pandemic. I think that they felt safe knowing that, we were putting every precaution in place that was available to us.
I think that anyone who needed any kind of medical care during the pandemic really felt the extra effort and the extra mile that St. Luke's and now St. Luke's Penn Foundation have gone to achieve you being able to reach your health goals. Amy, I'm going to turn to you for a second. I understand that there is a really exciting new service that's launched at the Sacred Heart campus, and it's called the SHARE program. How has Penn's Foundation's years of experience in this area helped build this new program within St. Luke's and at the Sacred Heart campus? Tell us what it is and then how it's helped.
Here at St. Luke's, in our rural areas, we've been doing some medication-assisted treatment. And what that means is there are special medications that folks can take that are prescribed and monitored by a physician that help with the withdrawal symptoms, that help with the withdrawal management, really. We have docs that have their waivers and their certifications in addiction medicine. In the same office, we have a substance use case manager who can help with social determinants of health, the needs that people have socially, financially, housing, things like that. We have a certified recovery specialist, and that is a person with lived substance use experience in her own recovery. We also have a toxicologist and a psychiatrist, and we're working together for the first time, I think anywhere, Ashley, that we have a program with toxicology and psychiatry working in the same office together to treat people for their psychiatric needs and their needs with medication. We also have a certified advanced alcohol and drug counselor in that office for the psychotherapy needs.
Maureen, talking about therapies. I hope I'm going to say this right, but I know that the St. Luke's Penn Foundation is going to be implementing a new technology, Unite's IOM2 interactive meditation and biofeedback program. That's a mouthful. So first of all, in layman's terms, tell us what that means and what does that really mean to better manage stress and the process for people that are maybe going through something?
This is an opportunity that's provided through some of our children's services and children and adolescent services. And it's a technology that's an interactive biofeedback meditation. So what that means is it's really taking feedback from your body in terms of your breathing and your heart rate, and it's syncing it with a meditation app. And so it's giving you real-time information about how your body is responding to stress and giving you information that's going to help you to, build the skills to train your nervous system to more of a calm state. This is a system that's really highly beneficial for folks who are experiencing stress, anxiety, or various forms of trauma. And this biofeedback program, along with our previously implemented safe and sound protocols, are therapeutic tools that we use and combine with other types of treatment based on the individual's needs, and can really build kind of a toolkit for people in terms of how to manage some of the things that might be coming up for them. We really want to equip children, adolescents, and their families with all the tools and resources that they need to manage the challenges that life is bringing forward for them.
Thank you all for such an engaging conversation. Up next, questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
What do you get when two visionary organizations with similar missions for caring for patients with mental and behavioral health issues decide to come together? Well, a partnership combining 210 years of award-winning health experience that will enhance our shared commitment to our community's mental health status, broaden the educational programming and services we deliver to patients and families in need, and improve patients' access to mental and behavioral health care. It's a growing geographical footprint featuring more inpatient and outpatient services, creating the largest fully integrated network of mental and behavioral health services in eastern Pennsylvania and New Jersey. United in mission and service. We are St. Luke's Penn Foundation.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about mental health services offered by St. Luke's Penn Foundation. Now let's read some questions from our viewers. If someone comes to the St. Luke's Penn Foundation campus for either mental health or substance abuse disorder treatment, do they have access to other St. Luke's medical care?
So we have individuals that really come from all over, from Bucks County, from Lehigh County, of which St. Luke's medical services are available in both of those locations. We utilize some St. Luke's physicians within our residential unit. We also have one on our campus here. And we also are able to refer to other physicians in the network, whether it be for primary care or specialty care. One of the great resources for our Lehigh County patients here is Star Community Wellness, in Allentown. Traditionally, individuals with substance use and mental health disorders do not, connect with physicians on a regular basis for annual physicals or specialty care. So it gives that opportunity for us to make those connections while they're in care with us.
All right, this might be for you, Maureen, but if I'm wrong, somebody else jump in. Are there plans to bring other specialty medical services to the St. Luke's Penn Foundation campus in Sellersville? So this viewer is down in that area and wants to know what'll be there soon.
Right now we have primary care here, which is fantastic and is already a huge complement to the campus. And I think the hope is that there's always going to be additional opportunities to bring specialty services to the campus. And this would just really be a wonderful opportunity for the community and for the patients that we serve here. As Amy mentioned, we just really want to make sure that while we're providing care and treatment for behavioral health needs, that we're also communicating with those medical providers and bringing them in as collaborators in treatment planning and as part of the team.
Excellent. All right, this next question, I think, Amy Allinson Dundon, might be for you, but again, if I'm wrong, someone else jump in. If I come to St. Luke's Penn Foundation for drug addiction, will my mental health issues be addressed at the same time if they're part of the issue?
We are co-occurring trained at St. Luke's Penn Foundation, and what that means is folks that have a mental health issue and a substance use disorder at the same time. We treat the whole person. We treat mental health and substance use at the same time. Obviously, your physical health is primary importance. So if you have to detox, we take care of that first, and then we make sure that you get the treatment that you need as you're going through early recovery, and that would include both substance use and mental health.
Excellent. The whole person, personalized medicine. I know that's a big mantra at St. Luke's and St. Luke's Penn Foundation. All right. Our next viewer asks, our community group is looking for someone to come and speak about mental health issues. Can St. Luke's Penn Foundation come out and talk to our group? And who should they get in touch with to make that happen? I think, Maureen, that's maybe one for you.
Yes, absolutely. So we do a lot of work in the community with our community outreach specialists and various staff members who go to a wide variety of events across the community. So community members can go to the St. Luke's website and navigate to the Behavioral Health Services page and find information there in terms of how to contact us and how to get in touch so that we can support your group.
All right. Amy Allinson Dundon. How are inpatient behavioral health services accessed, and how close to home might they be?
We have, I believe it's about 172 beds at this point. And we are in Carbon County. We are in Lehigh County. And so the best way, if somebody needs inpatient care, is to go to your local emergency room. Don't wait. If you're in danger, call 911, go to your nearest emergency room at St. Luke's. And from there, our crisis staff at any St. Luke's emergency department will help you get connected and transported to the proper inpatient unit or floor. You don't always need inpatient psychiatric. You may think you do, but there are levels of care here at St. Luke's in Carbon County and in Lehigh County where you can come to intensive treatment every day and still be able to go home at night if you meet the criteria. So again, the website would be a nice way to navigate to those services.
And good to know that there are a variety of options. All right, our last question. I think, Amy, Maurizio, this is for you. Often people are scared and nervous when they know they need help with an addiction, but they don't know where to turn. What do you want people to know about the kind of care that they can receive and will receive from the St. Luke's Penn Foundation?
What's important for people to know is that if they come to St. Luke's Penn Foundation or any of the St. Luke's programs or hospitals, they will be treated with respect. And I think that's important. Most individuals with a substance use disorder have historically experienced stigma surrounding those disorders, whether it be at their doctor's office, whether it be at a job. And I think that's what drives a lot of that fear. And so what's important is that they know they will be treated with respect, non-judgmental environment, and that we're here to help them get the services they need, no matter what that is. And if we can't help them, we'll find someone who can. And so we want to be that sort of one-stop shop that someone can come to and not have to worry about, making 12 calls or, being told this isn't the right place. So I think that's what's important, that we're here to help. And that's our number one goal, is to help people get connected to those services.
Thanks to our amazing panel and our audience for joining us. For more information on mental health services at St. Luke's Penn Foundation, please visit their website at sluhn.org or call 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.